Hi, everyone. Thank you so much for joining today. I'm Caren Howard, Mental Health America's Director of Policy and Advocacy, and we will start this meeting now. We're right at 3:30 and we have a really tight agenda, so we want to get you as much information and time for questions as we can. Thank you again for joining. This virtual Hill Day is an opportunity for affiliates to really raise their voices with Congress to advance upstream mental health priorities. And we really thank you for your participation, since this training is here to help you understand our 3 asks for prevention and peers, and an optional 4th ask for crisis funding. We also are using this time to offer a practice session so that all individuals within one state can get to know each other and do intros. Next slide. We know that we want to determine who might lead the asks within our meetings with Congress, and who also would maybe kick off the intros or otherwise. And so some of these questions will be answered in our practice sessions later. And any questions that come up about content or the legislative or appropriations process, we can answer in our first session. So after our remarks from our president and CEO, we'll hear from our lobbying firm, then our chief public policy officer with our asks, and then from Soapbox, our vendor who's helped with scheduling these meetings that we know you guys are really excited to have help with scheduling. And then finally, of another question and answer session. So I will now turn it over to MHA's president and CEO, Schroeder Stribling, who's been a consensus builder and visionary in her decades of service in the mental health field, and in nearly 2 years at MHA has kept our focus on prevention and early intervention and grown a focus on equity and social determinants of health. Please give a warm welcome to Schroeder.
Well, thank you so much, Caren, and lovely to see all of you affiliate leaders here today. I really want to join my voice with Caren's in thanking you for coming together for this important effort. As you know, Hill Day is a critical opportunity for your elected leaders to hear directly from you about the urgent needs and the priorities that you're addressing in your states and regions. So we are extremely thankful for the time and effort that you are extending, and we know that the representatives and the staff with whom you're going to be meeting will appreciate and will benefit from their time with you. I have had the good fortune and good pleasure of meeting many of you since joining Mental Health America last year. But for those of you whom I don't yet know, I wanted to take a moment to introduce myself more personally. As Caren, I think, mentioned, I'm a clinical social worker by background and training, and I spent the beginning of my career in inpatient settings, including the very beginning of my work in a public hospital in Massachusetts, Westboro State Hospital. And over time, I transitioned to nonprofit leadership, and before coming to Mental Health America, I was with N Street Village for 17 years, which is a large nonprofit in Washington, D.C., focused on homelessness and wraparound services, shelter and housing and wraparound services. But like many, I came to the field of mental health by way of personal experience and have been affected by both personal and family mental health challenges and times of crisis. My father's story was certainly formative in my life. He struggled with depression and substance abuse, which in his life led to numerous hardships, including suicide attempts and jail, and ultimately homelessness before he died at age 48 of AIDS. And this was a dramatic downfall for someone who had been once a young and promising Methodist minister. So that story is always very near to my heart, obviously. And I myself have struggled with anxiety and post-traumatic stress that in my early life was at times debilitating. I am very fortunate to have had the benefit of both early intervention and access to the care that I needed when I needed it. This is something my father did not have, and something which too many Americans, as we know, still do not have. And I know that I am not alone, that these difficulties or versions, variations on the theme of them touch all of us in some way. Some days they touch us under our own roofs, and some days under those of our neighbors or our colleagues or our elected leaders. I know you all come here with your own stories that you carry in your hearts. This is our common interest, and at Mental Health America, it is our common commitment to the public at large. So I'm so very grateful to be working with all of you in this mission now. The history of Mental Health America is a powerful story of progress. We have affected the landscape of American mental health throughout our 114 years. And we know that we have much farther to go, especially now as we are facing such a dramatic and rising tide of need and a really frightening crisis of despair, especially for our youth. So this makes your efforts, our efforts here today, all the more critical. And I want to thank you again for your leadership and for your participation in this advocacy and in the work that you do every day. Affiliate participation was critical to our success last year with our federal policy priorities, and we had some very significant wins. And I also want to acknowledge the Caren and Mary and the staff at the national office. Together with you, we were able to win the coverage of peer specialists in Medicare, recognition of the importance of prevention and early intervention by both Congress and the administration, unprecedented funding for mental health programs, including in the mental health block grant, and the elimination of the X waiver, which is going to provide, improve life-saving access to harm reduction medications for those with substance dependence. So I do want lastly to say that we're particularly grateful for your participation in today, in this Hill Day, because we know that you are simultaneously working to advocate and inform leaders at the state and local level, all while also running vital programs in your communities and often coping with communities who are in crisis or experiencing trauma. We know that there is a lot on your plates. We are very appreciative that you're taking time to work with us on this federal advocacy, which benefits so much as we were discussing from your participation. So we truly cannot do this without you, and we trust that our collective efforts at the federal level will continue to lead to meaningful outcomes for the entire national network. So lastly to say, on behalf of the board and the staff, we honor your commitment, we applaud your good work, and we appreciate the time you're dedicating. And with that, I am now pleased to welcome Erik Fatemi, Principal of Cornerstone Government Affairs, who is going to review the congressional appropriations process. So thank you, Caren, for the organization and the invitation. Thanks, everyone, and welcome, and thank you, Erik.
Thank you so much, Schroeder. It's really an honor to be part of this. My own daughter has struggled with anxiety greatly, and fortunately we're able to get some help for her. But I want to say just personally how much I appreciate the work that you all do and the goals that you're going to be taking to Congress this week. You are coming at the perfect time. The fiscal year 2024 appropriations process is starting now, and let me explain what I mean by that. So the fiscal year 2024 process, the funding starts on October 1, and it runs for a year. The Congress is working on, they're starting to work on those appropriations bills right now. So there are two committees in Congress that basically divvy up the annual appropriations for all kinds of programs across the government. There's a House Appropriations Committee, there's a Senate Appropriations Committee, and they've asked every member in Congress, tell us what's important to you. Transportation, health, education, etc. This is your opportunity, members, to say what is important to you. Let us know. Those members are having meetings this week, next week, following week, with groups like MHA, all kinds of issues. They are in the process of compiling the lists of their most important priorities. We want to be on that list. They're going to be meeting with hundreds, potentially of advocacy groups, and we want to get our priorities to the top of that pile. So it's important enough to them to say, our priorities include what MHA is asking us for. And nothing is more meaningful than hearing from constituents. So I was a staffer for 12 years on the Senate Appropriations Committee, and I did, hundreds, probably thousands of meetings during those 12 years. And I will tell you from personal experience, nothing matters more than hearing from the constituents. It's one thing to hear from professional lobbyists, but nothing is more meaningful than hearing from the constituents what is actually happening in the districts and states. Those are the voices that the staffers and the members will remember. So how do we make the best case? Let me start off by noting the obvious. This is a very partisan environment right now. It is an extremely divided Congress. It's almost, the balance of power is almost exactly divided in both the House and the Senate. But thankfully, mental health is something that does not know party lines, and the members and the staff that you're meeting with are not going to be hearing this as a Republican priority or as a Democratic priority. I guarantee you that everyone you're meeting with is either dealing with mental health challenges of their own, or has a family member who is dealing with it, or someone else close to them is or has dealt with a mental health challenge. So you don't have to worry about the partisan environment on Capitol Hill. You're coming in with a powerful message that transcends party lines, and every state and district is dealing with that. For those of you who have done it before, you know this, but for those who maybe are doing it for the first time, do not feel intimidated. No one is going to object to the meaning and the importance of the issue. They might say, we don't know if we're going to be able to fund it at that level, but no one is going to say to you, this is a wrong cause, because it's an important cause that transcends the party lines. So Mary, in a moment, will be going through and talking about the asks. And it's really important to pay close attention to what she's saying, so that you understand the exact ask and get them just right, so that they're hearing, all the meetings that happen, we're all delivering the same message. But what you can do, and only you can do, is share the story of what's happening in the district and state. And that is going to be the thing that the staffers and members that you meet with, that's what they're really going to remember, is what is happening in their localities. No one else can tell them that, only you. And that will be something that makes it, powerful impression. So take a couple moments and give that story. The members and the staffers, they can't, they can't know everything that's happening in the districts. They rely on folks like you to tell them. So share that story. Allow space for questions. The best kinds of meetings become a conversation. So when you tell your story, you make your asks, then I'll invite a conversation. Do you have any questions? Is there anything you would like to talk about? And that is, really when you have the best kind of meeting, is when you're able to have that conversation. One thing to note, though, is that mental health raises so many topics that the staffers and the members, they might have questions about all kinds of tangents that are not directly related to the asks. You want to try to keep the meetings from going sideways into all kinds of other directions. Not that the questions that the staffers or members might ask you are not important, because they may very well be. Try to answer them succinctly, but encourage the opportunity to discuss those kinds of questions at a different time. Answer them succinctly and say, I'd really like to follow up with you about that at another time. Today, I'm here to talk about these asks. So you really keep the focus on the asks that Mary will be going through. Again, those of you who have done this before, these kinds of meetings they're meaningful, they're enjoyable. I think people often come back and want to do them year after year because they see that they make a difference and they are able to have good conversations. And for those of you who are doing it for the first time, I think you will find that you'll really enjoy this and want to come back again next year. And of course, you're trying that idea of coming back next year, you want to build that relationship with the staffer and the member so they get to know you. So say thank you and come back again next year and develop that relationship with the member and the staffer. That's all for me, unless there are any questions.
Thank you so much, Eric. In 2020 and 2021, Congress passed one-time COVID funding, which was helpful, but it would not sustain over the long term and would not target youth or prevention. In 2022, we had some progress, both the Bipartisan Safer Communities Act, which was the response to the Uvalde shooting, and the Consolidated Appropriations Act in December's omnibus bill made investments that we liked, including funding to hire mental health professionals in schools, funding for research on the impact of social media on youth, guidance for schools to bill Medicaid for mental health services, some pediatric programs, coverage of peer specialists in integrated care, and as part of mobile crisis teams in Medicare, over $500 million for the 988 Lifeline Network, which includes funding for local crisis centers that some of you all run, and over $1 billion for the Mental Health Block Grant. However, Congress did not enact a really critical part of our priorities in the Mental Health Block Grant, and Mary Giliberti's MHA's Chief Public Policy Officer will now discuss more about that, as well as our second ask.
Thank you, Caren. So I am excited to chat with you about the first ask that we have. It's to increase funding for states in the mental health block grant to $1.25 billion. And then the second part, which I'm going to describe in more detail, is what Caren was just talking about, which is to give states a little more flexibility so they can fund early intervention and prevention services and supports. And remember that when you're doing these visits, I was a Hill staffer for several years and did a lot of these visits myself. They don't expect you to be an expert on every aspect of these programs that I'm going to talk about. What you are an expert on is your lived experience, what you're seeing in your communities, what your organizations work on. And that is really relevant to the first ask about the block grant. Because the block grant itself is the biggest, and really one of the most important programs in the labor HHS appropriations bill for funding mental health services and supports. It's a great source of resources for the states. They use it to help people who are uninsured or can't afford their treatment, or to plug gaps where insurance may not cover services. I know you all see this every day, crisis services, for example, or supported employment, things that aren't typically covered by many insurance programs. So states have flexibility to meet those needs. So we are requesting the 1.25 billion. Last year, your advocacy helped us get over the $1 billion mark, and we were very excited. So thank you for that. You know, I keep saying billion with a B. We got there, but now we want to keep going and get further to 1.25 billion. And you know, we know the need is tremendous, right? Caren gave you some wonderful data in the talking points that you have, that over nearly half of adults do not get treatment who need it, and over half of children do not get treatment who need it. So we know that the need is vast, and we are asking for continued increases to meet this tremendous need. The continuing crisis, as data is telling us, is not abating, right? We know it's continuing. So that's why we need these resources for these tremendous gaps that we still have in our local communities. And to the extent that you are working in programs that you want to talk about, that will be terrific too. So in addition to asking for that increase, we also want to have some additional flexibility to take a small portion of the block grant, 5%, small portion, and allow it to be used before people are seriously mentally ill or children have serious emotional disturbance. Right now, the block grant is limited to people who meet those qualifications. Well, we all know that is way downstream, right? People who are already diagnosed in our system, SMI or SED. We want to be able to serve people earlier. And Ben Harrington, who I see is on here, my friend from East Tennessee, was talking to me about this weekend. And he said one of the most effective arguments to legislators that he's seen is working to close that 11-year gap between when people first experience symptoms and when they actually get help. We don't want people to have to wait that long. We want states to have the flexibility to invest earlier, right, and go a bit upstream. So the substance use block grant allows sets aside 20% for prevention. And we know that many times people turn to substance use because their mental health condition wasn't treated, right? And it's a way that they use to compensate for that. So we really want, if we're going to get upstream with substance abuse, we certainly should try to go upstream with mental health, right? So that's our argument. We'd like to see for our first ask an increase to the block grant and some additional flexibility to serve people earlier so we can close the gap between when people first get symptoms and when they get help. Our second ask. I see, oh, there's a question there about whether it is a set aside or would they have the option. That is a very sophisticated question. And I would say at this point, we are framing it as they would be allowed to. So that is the flexibility to invest up to 5%. We definitely would love to see a set aside, but last year in the House, the bill that passed the House had it as an option of flexible use. And so we were using that language, would be allowed to use up to 5%. Okay, let's move on to the next ask. The next ask is to provide $5 million in funding for a new behavioral health coordinating unit at the CDC, the Centers for Disease Control and Prevention. So we know CDC works to keep people healthy, and at Mental Health America, we all say there's no health without mental health, right? So we want these additional resources to coordinate across CDC programs and promote well-being. So whatever CDC works on, whether it's working with state education agencies, with local schools, in communities, on suicide prevention, in all this work, we want to see it coordinated and aimed at promoting well-being and resilience. You know, we've all seen the statistics that are in your packet. The one that really just gets to me all the time is CDC data. It's that 1 in 3 adolescent girls in 2021 were considering attempted suicide. You know, that is just an enormous statistic, and it makes you realize that treatment is not going to be enough. We have got to address the causes. We've got to deal with education, resilience. So there are agencies in the federal government that work on treatment, but we need the CDC to be working on well-being, resilience, community responses, so that we can help people close that 11-year gap and help them before they are in crisis, which is one of our later asks. So this request is for $5 million for CDC to take these activities to do a national strategy with goals and work with all communities to develop this and disseminate a plan moving forward. And then also to provide technical assistance and work in local communities with youth serving organizations, with community organizations to again promote well-being, resilience, education, early intervention, and get really upstream, because treatment is not going to address the size of the crisis that we are seeing. We need to have this healthcare, kind of full healthcare, whole healthcare approach going forward. And I know a lot of you work in the prevention and early intervention field, so you can share the work that you've been doing, why you think it is so important to approach mental health the same way we approach diabetes, heart disease, and even substance use, so that we can get ahead of these conditions and avoid crisis. Thank you. And Caren, I'll send it back to you for the next ask.
Thank you, Mary. For our third ask about peer support, as many of you know, but most congressional staff don't, so it will be important to educate them. Peer support specialists are people with lived experience of a mental health condition or substance use disorder, and who have formal training and use both to help another person who's not as far along in their recovery. Peers are reimbursed by over 43 or 44 state Medicaid plans and have certifications in all states now except for South Dakota. And this is important because states are going to want to know, congressional offices are going to want to know, okay, what is our state doing about peer support already? Our big ask is to go beyond what states are doing and allow Medicare to cover peer services in any and all settings. Thanks to the work of MHA affiliates and our partners, peer specialists were recognized in federal rulemaking by Medicare for the first time in history last year as auxiliary personnel allowed to bill incident 2. We have to give a big thank you to everyone who filled out the action alert and all those who, made calls to their offices on this, because it's my understanding it takes on average 7 years for a bill to become law, and we got ours passed in about 2.5. So Congress recognized peer specialists in Medicare statute for the first time by authorizing peer support specialists as part of integrated behavioral health care and as part of mobile crisis teams. This new authority will be enumerated in the 2023 rule that Medicare puts out. And although we were successful, we would like to see to it that peers are not limited to just those 2 settings, but we'd like a new bill in the 118th Congress to reflect greater coverage of peer support. And we'd like to recognize our affiliates in Louisiana and Connecticut for their help, especially with securing Senator Cassidy as a lead co-sponsor of the peer support bill that passed last year. And he is actually now ranking member of the Senate Help Committee, which means that his support will be critical to enactment of any new bill. We've worked closely with NASHBID, the state mental health program directors, DBSA, the Depression Bipolar Support Alliance, and NAPS, the National Association on Peer Supporters, on peer coverage in Medicare. And we all agree that we'd like to see high payment rate reflected for peer services. So in our new bill, we will make sure that there's language to try to reflect a better reimbursement rate than what Medicaid pays for peers currently. In the meantime, where your knowledge and expertise will be most important is in informing offices about the versatility of peers, helping them understand that peers are already working in primary care and emergency hospital settings, as well as part of mobile crisis teams and in the community otherwise. And our ask is to support new legislation allowing full Medicare coverage of peer support in any clinical, community, or crisis setting, just as was done in December for marriage and family therapists and licensed counselors. So that's our third ask. Our fourth ask is optional, but very important to many affiliates and across the entire nation, increasing funding for 988 and behavioral health crises. So the 988 Lifeline is a network of local crisis centers and backup crisis centers that are available 24/7 to individuals who need support for suicidality or mental health crises. If you guys are not yet part of the crisis jam that meets on Wednesdays, it's a really informative and powerful way to learn about what's happening on the ground, including some of the partnerships that SAMHSA, NASHBID, Vibrant, and other stakeholders have been building and forging, including with 911 and other emergency responder networks and departments, so that there is some coordination and information sharing between these kind of two fields as 988 continues to grow. And the Lifeline received funding from Congress through the National Suicide Prevention Hotline budget line at SAMHSA, and that has been renamed to the 988 and Behavioral Health Crisis Services budget line. So it's no longer the National Suicide Prevention Hotline line item. It's the 988 and Behavioral Health Crisis Services line item, and we have two kind of particular asks under that one line item. In addition to requesting the funding for network operations, we are also requesting funding for a public education campaign to help SAMHSA and Vibrant research and message test and conduct outreach and nationally about the services offered by 988, including ensuring to reach subpopulations that have been historically marginalized or not certain about the safety of using 988. And note, I just said the wrong term because I wanted to demonstrate that while we understand terms like public health, public awareness, and social supports, these words can actually be triggering for certain offices. So in our fact sheet, note that we're saying education campaign and not a public awareness campaign. The last thing I want to just note is it's very important in your meetings with legislative offices to inform them of just the fact that there's been exponential increase in the demand to 988, and that's why the dollar amounts have increased so much. In December 2022, calls answered increased by 48% compared to December 2021. Chats answered increased by over 250%, and text messages were answered increased by over 1,400%. So, there hasn't even been a marketing campaign to really share nationally the availability of 988. However, people are starting to reach out, hear about it, and use it. And so the additional funding that we're asking for has increased. And this year in FY24, we're asking for $756 million for operation of the 988 Suicide and Crisis Lifeline operations, as well as an additional $225 million for the education campaign within that same programmatic line. It's important to note these kind of two separate topics or categories, especially as you're submitting your FY24 appropriations forms. And I dropped a link into the chat for you, which is a form for Representative Bonnie Watson Coleman's office of New Jersey. So if you're in a meeting with her, this is the follow-up form that would be submitted after your meeting to say, hey, these are our 4 asks that we're requesting. This is what we discussed in the meeting, and I'm putting it in writing now for you all. It's 4:05 and we'd like to stop and pause for questions. So I saw a couple come into the chat, but if anyone wants to share additional questions or come on screen or unmute, we'd love to hear from you guys before we go into the Soapbox Advocacy tool.
Caren, there were a couple of questions in the chat that I can start with, and then maybe people can pick up. There was a question in the chat about, I think it was Tia asked about SAMHSA versus the CDC, and that's a question that does come up. I think the way we like to talk about it is SAMHSA does treatment, and it does that for both mental health and substance use, and CDC takes a more an approach that is a whole health approach, an approach that is looking at communities and trying to promote well-being and resilience in community. And it does that for substance use as well. So there are resources currently going to CDC for substance use to take that approach, just like there's substance use money that goes to SAMHSA for treatment. So it's the difference between treatment dollars, which is at SAMHSA and CMS actually, versus an approach that's more about working with community organizations, youth organizations, schools, state agencies, and others to promote health and well-being and resilience, and approaches that will grow those aspects. And then there was another question about whether the resources were for FTEs or for programs. The vast majority of the resources would be allocated to programs. So CDC may add some FTEs, but the vast majority would be for programs.
Okay, well, thanks so much, Mary, and everyone who's requested more information about the bills and our funding asks. I see that our next speaker is on, so we'll spotlight Christopher Kush from Soapbox Advocacy, who will now go over the mobile tool and how you can check your schedule and start meeting with your state folks.
Great. Thank you very much, Caren. Thank you for inviting us to be part of this Advocacy Day, and thank you for the work that everybody is doing to advance these issues. I am going to review the Soapbox mobile tool with you now to kind of give you an idea of the types of resources that are available to you at that website. And then we're going to give you an opportunity to go into what we call your practice room. And your practice room is, for most of you, it will be the same exact room that all of your meetings are scheduled in. So we're going to have you go to your practice room and make sure that you have your video and audio up and running, just like it is here. And for many of you, you'll have some of the other folks that are part of your meetings, and you can even take some time to start talking about how you want to divide up these issues that you will be discussing. So the first thing I'm going to say is, by now you should have received via email your Soapbox mobile tool code. And you can stop, you can leave the slides right there. So by now you should have received via email your Soapbox mobile tool code. It was an email that came from Soapbox. There are sometimes you can look in your spam filter if you don't see it, but I have an easy way for you to get your Soapbox mobile tool code now if you never received it or can't find it. In the chat, I am putting a Soapbox email box. It is for Silwal, S-I-L-W-A-L, at soapboxconsulting.com. If you send an email to Silwal at we will send you your mobile tool code now during my remarks. And you'll need that code in order to get to your practice room. So if you don't have your mobile tool code or can't find it, you want to send an email right now to silwall@soapboxconsulting.com. The exact spelling is in the chat. All right, let's move forward. The rest of you should have received that mobile tool code, and maybe you even looked at your schedule. Your schedule includes the links to your meetings so that with a simple click, you can get right into a meeting room and start your discussion about these issues. Next slide. Here is a map of all the meetings that we're going to be doing. It was generated in terms of your geography. So you're meeting the folks where you live and or work. You may be represented by somebody who belongs to a political party that you belong to, and you might not. In any case, we don't discuss politics. That is, we do not discuss elections. We do not discuss giving and donations to candidates in these meetings because we're talking about actual legislation. So we're prohibited from doing that. And I want to caution everybody that we need the help of anyone who is willing to help us. And we can't always assume that we know how personal their connection is to mental health. So every single office you meet with is an opportunity. I'm going to ask every single person here to warmly and sincerely ask the office for their support on our specific issues, regardless of their political affiliation. Next slide. For those of you who've done this before, keep in mind that there are a bunch of new members of Congress, and they may not be aware of the programs that exist, and they may not have a deep knowledge about mental health issues. So those new members will be marked on your mobile tool, and I'm going to tell you how to see them. And just keep in mind, especially if you're a seasoned advocate, you want to be in a certain frame of mind when somebody new doesn't know an acronym, doesn't know how the issues are structured. You're going to want to roll your eyes because you've built a great relationship with a previous office, perhaps. But we want to be patient and we want to be kind because this is the next generation of our potential champions. So please keep that in mind if you see the new on your schedule. And again, I'm going to show you where to find it. Next slide. The Soapbox mobile tool is not an app. So I'm going to say that one more time. The Soapbox mobile tool is not an app. It is just a website. And because we're doing meetings or webinars, you want to go to the Soapbox mobile tool on your desktop or laptop. Do yourself a favor, and whatever you have that has the biggest screen and some kind of internet browser, use that device. So you just go to a website, sboxmobile.com, and you enter in your code, and it will show you your schedule. In addition, that device will remember your code, so you don't have to keep entering it time and time again. The reason why we use this is because congressional meetings can and do change up until the day of the event, even through the day of the event. And because of that, we need to have a real-time tool to show you what the latest is with your meetings. Some folks have registered for this event just last week, and you may have TBAs on your schedule. Those are requests that we've put in. We're still trying to get those, but we've only been working on them for a short time. So you want to use the mobile tool to see where are we with some of those late requests. Part of the mobile tool, when you first log on, will ask you for your cell phone number. And that is because we are far apart from one another. You will receive a push notification 1 hour before each one of your meetings. You will also receive a push notification on Thursday if something changes on the day of the event. But until that time, you want to check the mobile tool and you want to use the mobile tool because appointments can and do change on Capitol Hill. Next slide. Your schedule on the Soapbox mobile tool is listed in time order, and it includes an easy link for each and every one of your meetings. In addition, that link for most people will be the same room, so that if we can get you to get there today, we're going to be good to go for most of your meetings as part of your official schedule. Your meetings are listed in Eastern time order. So that's why we send the reminders, but you want to remember, if you're in Mountain Time or Central Time, you want to remember that the meetings listed in the mobile tool list them in Eastern Time. That's what the ET means after each meeting time. Underneath that, you'll see who you are meeting with from each office. It will typically be staff for an online meeting, and it will have the staff name and the staff title. That's who you will expect to see a few minutes before your meeting starts. You have the easy meeting link to connect to your meeting. And then at the bottom of each meeting notification, you will see if somebody is on one of our key committees. So if you haven't done this before, don't worry about it. But if you're more seasoned, you'll at a glance be able to see if somebody's on leadership or one of our key committees. And this is where you will see the word new. If you have a new member of Congress in this district and you want to slow your roll and make sure that you start building up a solid foundation on these issues for them. A couple additional things to say about the links. These are not town hall meetings. They're not open meetings with these members of Congress. So nobody else is invited to attend these meetings. And in fact, these meetings have correct rosters of who they are expecting to see. And also they're expecting to specifically discuss our specific issues that we talked about today. So these are business meetings. Please do not post these links anywhere. Do not share them with friends and family. It is not okay even to decide that you've got somebody who has a perfect story. You must go through Caren so that we can alert the office of who they are going to see. It's extremely partisan on Capitol Hill these days, and it can throw an entire meeting off if somebody shows up they weren't expecting to see and they're wondering who that person is. So these meetings are specific, they're for you. If there's some reason that somebody else needed to join your meeting, please go through Caren so that we can add them to the official roster. At the bottom of each meeting, you'll see a feedback form button. You can press that to give your team here in DC some details about your meeting. Let's go to the next slide. Those details are important even if somebody is friendly and has always been friendly. And they're not just if somebody makes a firm commitment on the issues. These questions allow your team here that fights for you and your clients through a long and complicated process. It allows them to continue the conversation where you've left it, rather than having to go back to the beginning. So please provide some details on each and every meeting on your schedule. There is a place underneath the feedback questions where you can even attach a photograph if you would like to, with permission, take a still photo of your screen and you can post it here. Please note, in no case, so in 0 of our meetings, did we ask for and did we receive permission to videotape any meeting or any portion of a meeting, or audio tape a meeting or any portion of the meeting? That must be done with permission. We do not have it right now. Please do not videotape any piece of the meeting. Please do not audio tape any piece of the meeting. That would be a serious transgression that would probably move us backwards with the office rather than forwards. Next slide. Before we go to our practice rooms, I'd like to let you know a couple things. One is that there's really only one way you can hurt yourself on Capitol Hill when you are a constituent or you are providing services to constituents. And that's to not show up during this time, the busiest time of year, for a business meeting that you've taken on their schedule. So if you are not planning on attending a meeting, if you cannot attend a meeting, if you have a business conflict, we get it. It's okay as long as the office knows that we can cancel that meeting. If you just don't show up to a Zoom link and they're expecting to see you at a certain time, they very well might remember your name and your organization's name for all the wrong reasons. So I am asking you now or on the day of the event, if you know that you cannot attend a meeting, please let Soapbox know. The way to let Soapbox know is to call the live help desk, which is here in the upper left-hand corner. It is 202-362-5910. Okay. And I appreciate people who are asking for their mobile tool codes. We want to go to Silwal, SILWAL, at soapboxconsulting.com. Rebecca Fowler has just attached or has just noted that in the chat as well. If you've been trying to get in, please again, send an email to Silwal at soapboxconsulting.com for your mobile tool code. Okay, with that, I'm going to describe now how you get to your practice room. When I am done here, everybody will go to sboxmobile.com. That is the Soapbox mobile tool. And you will put in your code if you haven't already. If you have, your device will remember that code. You'll put in the code. If it's your first time, give us your email and get through the little introductory screens. And then you're going to be at the main landing screen. And you are going to see your schedule in the upper left-hand corner. It will say the word schedule. You see a picture of it here on this screen or on this slide. So you'll see that icon and you're going to press schedule. And then at the top of that page, you're going to see this orange box. And that orange box is going to have a link in it where you can go to the room that most of your meetings are going to be into. You just need to get there and make sure you can get there and your computer can get there. But many of you will discover that there's some other advocates in the room that share your schedule. So if there's anybody else in the room, please, by all means, take the time to introduce yourselves to each other. Take the time to plan your meetings. If there's nobody else in your room, it's still very important for you to get there and make sure that that works. And then there will be time for you to rejoin with us back here and ask any final questions you might have. Remember, beyond the code, through this process, there is live help waiting to help you right now as I speak. And that's at this phone number, the help desk phone number, 202-362-5910. And I'm going to put it in the chat as well, so that if you have any additional needs, if you want to tell us about any cancellations that we need to make, any meetings you can't attend, then you can call us at this number and we'll be happy to help you. With that, I'm going to turn it back over to Caren to see if there's any final questions, anything I needed to speak about that I didn't speak about. Caren, while you get back on, I want to talk about materials.
I don't think so, Christopher.
Okay.
I think that's everything.
So there's one more thing, which is you have copies of your issue briefs on the mobile tool, but we will send them with our confirmations to every office. So every office will have a copy of them, but their inboxes are overflowing. So you're going to hear from a couple offices, you're going to hear I didn't get them, or I don't think they sent them to me, it's all right. We can resend those documents if somebody didn't find them in their mailbox. Just remind us of that on the feedback form. One more thing that will happen on Thursday for a couple of you. As the day goes on, staff gets a little bit later to each and every meeting. And especially there's so many people on the Hill right now, if they're trying to sneak into a quiet room to do a Zoom meeting, they might be a little late. If you are in a room on Thursday waiting for staff, please understand that they might be late to the session. Please give them 10 to 15 minutes and then call that help desk. Stay in the room once you call the help desk. We'll find out what's going on. Typically, they're on their way, but we'll find out what's going on, and the member or staff or we will come into the room and start the meeting. Usually it works out, but the reason why I'm saying this is if you have a team, you don't want the team to go away and then the member or their staff finally gets there and then everybody else is far away. So just keep that in mind. They might be late and it might feel like, I don't know if somebody's coming. Call the help desk, but don't leave the room. Okay, with that, I'm putting the Soapbox Help Desk phone number in the chat. Oh, I'm sorry. Did I keep saying Thursday? It's Wednesday, sorry. Everybody, I should have been saying Wednesday. If I had said Thursday, I apologize. Thank you, Kathy Rogers. It is Wednesday. I'm going to put the Soapbox Help Desk number in the chat, and I'm going to ask everybody now to start making their way to your practice room.